I like to refer to our process, the resiliency method, as more of an algorithm. People oftentimes are oriented to, well, I've got adrenal fatigue. So what's the protocol for that? And that's not really the way we work. That's a good entry for many and can be, give them some result for a period of time. But in the longer run, we're really trying to understand what's bugging out the adrenals on the regular.
Do you feel like your hormones have turned against you? Trust us, you're not alone.
We're Dr. Serena and Dr. Heidi, and on Hormone Heroines, we explore all the root causes that are behind hormone imbalances, and we teach you how to thrive through them.
Join us for real talk, expert tips, and even a few laughs.
Hi, and welcome back to Hormone Heroines. I'm Dr. Heidi.
And I'm Dr. Serena, and today we're going to be talking with Dr. Erika Schultz. She holds a doctorate in Chinese medicine and is a certified applied clinical nutritionist who transformed her own journey from chronic illness to vibrant health into a revolutionary healing system. This breakthrough led her to develop the Resiliency Method, a groundbreaking approach that blends ancient healing wisdom with modern functional medicine to address the root cause of chronic health issues. Now based in Denver, she leads a team of health coaches and works with clients nationwide. Welcome. We are so excited to have you.
Thank you for having me. I appreciate being here.
Yeah, so let's dive right in. What inspired you to create the Resiliency Method?
Wow, yeah, that's a combination, I guess, of my own health journey, as it is with many practitioners, but in particular, probably also my combined with my tenacity. As a young person hitting puberty, I started having grand mal seizures, and it was a condition for which medication, actually, and fairly small amount of medication, managed very well for many years. But in the back of my mind, and because I had parents who were a little bit more wellness minded in their approach to our raising us and upbringing. We were always, or I guess in the back of my mind, I always knew there was something going on that was making me express that condition. And even though it was controlled and I wanted it controlled, especially as a young person, and didn't want to have it in the forefront of my mind, as I got into my 30s, I guess it was, I started to have some decline in other areas of my life, even though the seizure disorder was controlled pretty well. And, I started to have that creeping feeling that many of us get that goes, "Hmm, what else should we be doing? What should we be
Mhm.
looking at?" And those symptoms that I was having, fatigue, really what amounted to thyroid problems, was really starting to creep in, become more prevalent and more, interfering with my life. And so, like many people, that's when I started to take really, action on my health and start getting into a journey of uncovering what was needed for my body. Starting being raised again by my father was a chiropractor, my brother, my twin sister, they all became chiropractors. I had a corporate career for many years, but I always had an itch on my back that was like, you're supposed to be in the wellness field. You're supposed to
Mhm.
be doing something other than what you're doing.
Yeah.
And that itch finally got to the point where I needed to scratch it. I left my corporate career, went back to school midlife, and started to study ancient medicine. It was acupuncture that really propelled me into that because I had a case of plantar fasciitis, and acupuncture helps. So that kind of opened that door. Once that
Mhm.
door was open, I just kept going. Within my first year of grad school, though, my health was really bottomed out. And it was at that time that my twin sister, who was studying this nutritional testing technique, she really encouraged me to just go see this practitioner in town. And she said she could help, but it all seemed a little woo woo to me because it was using AK, applied kinesiology,
Yep.
Mhm.
We know it
consumable.
very well,
You
actually.
know that very well. Good.
Yeah.
And so it just seemed kind of strange that I do that, but I got to the point where I didn't care. I would do anything. And not kidding, within weeks, I was like going from not thinking that I was going to make it through the rest of that program. I had 3 more years, and it was intense study and full time. And I became so inspired at that point that I just really wanted to learn everything that I could about health wellness. I started taking courses through a local training center where they're bringing in nutritional speakers, people that had, really large nutrition practices across the country. And I started learning from some of the best clinicians and also started to open up the door to functional nutrition, functional medicine. And it was life transforming. So I went from that place to then I decided my part time job was going to be to open up a nutrition clinic. And I started seeing clients when I was still in grad school. And so when I graduated, I had a practice in Austin, Texas. Eventually, made my way back to Denver, Colorado, was doing that incredible work for about 10 years but then started to feel like I was plateauing again. And I got to the point where, just again, that another itch on my back, literally, that was like, you're missing something here because the seizure disorder wasn't gone. The seizures were actually starting to increase a little bit more. And there were some things that we were doing clinically that made me wonder if we needed to be going a little bit further. And that thinking came from my background in Chinese medicine, understanding herbal medicine at a really deep
Mhm.
level, understanding how the body uses herbs. And just seeing also combining that with my education background in whole food nutrition and knowing that the body really heals through food. Herbs are fantastic, but they should be used for periods of time for direction and in substitution
Mhm.
of pharmaceuticals. But
Yes,
really that
I
exactly.
can agree more.
yeah, yeah. It just felt like I needed to go in a different direction. So that's where, or I should say, not in a different direction. The direction I had was great. The foundation was in, but me and some of my patients were plateauing and we needed to go further. So we used that technique that I had been using for many years. We still use it as a foundation in our clinic. But now we have introduced almost 2 more phases into our process, and it's a total health transformation for patients at a root cause level. And specifically, what we do is we use supplements, herbs, whole food, homeopathy, all the whole gamut, which is pretty cool, even some nutraceuticals for periods of time. But we're really targeting with that nutritional supplementation, we're going after the root cause
Mhm.
of the organ, tissue, or gland dysfunction. So we can talk about that more too, and what that looks like.
Yeah, you're speaking our language. We're both
Yeah.
naturopathic physicians, so
I
we
love it.
we
Yeah.
do all of that
Yeah.
stuff. Yeah.
You guys
Yeah.
actually have a lot in common with the history of thyroid and
Yeah.
the background in nutrition and
Mhm.
all of that stuff.
Yeah, I was a
So,
nutritionist and a master trainer before I went to med school,
yeah.
and then I
Oh,
had
wow.
4 kids when I went back to med school or when I went back to school
Yeah.
completely and did med school because if you're really gonna scratch the itch, you might wanna scratch it all the way.
Yeah, right?
So I know part of your things that you work on is you work with a lot of high performers. So you often say that the high performers are some of the sickest people. Why do you
Yeah.
think conventional and even functional medicine often fail them?
Yeah, oh, good question. Well, so I think it really sneaks up on high performers. I almost feel like in a sense they get fooled a little bit. In
Hmm.
other words, what I mean by that is some of the strongest capabilities and the smartest and most intelligent and successful people in our communities are entrepreneurs, high achievers, high performers. And I would put myself in that bucket, quite frankly. And one of the things I started to discover as I started to unwind further, and really that add on to what we were doing at a foundational level really had a lot to do with looking at the nervous system
Hmm.
and the brain in particular. And what I was seeing was that a lot of times what was driving me as a high performer was this upregulation on the regular with my nervous system. Because
Yeah.
even though the seizures were under control with medication, it wasn't that my nervous system was really fully addressed or my brain was fully addressed. It's just that I wasn't having seizures. But ultimately, the root cause of what would cause me to have that kind of an episode or that expression symptomatically was still at play. And it was showing up in other ways. This is complete overdrive, and a lot of times being in sympathetic mode and having high cortisol levels on the regular, and chronic adrenal fatigue, and running around and managing the thyroid all the time, and continuing to do what I call the merry-go-round of management of some of these conditions. And I always describe it as like if we're looking at the organs, the tissues and glands in the body, and we're looking at the gut and we're looking at the thyroid. It's like we're focused at the airport on the airplanes. And the airplanes are nice and tidy and they're cleaned up. The passengers are loaded. The symptoms are getting better. But ultimately, over time, if we continue to just focus on the airplanes and the passengers and loading them and such, and then we go to take off and we forgot the fact that down the tarmac is this air traffic control tower and the steps are routed out, and the air traffic
Hmm.
controllers can't get to the top, and that's the brain and the nervous system. So the signal oftentimes from the brain is what is causing the chronic situation that we're always managing with the herbs, the supplements, and
Right.
we're doing great work with that because we brought many of these people back online, quite frankly, and
Yeah.
we've given we've given them, a better alternative to pharmaceutical, allopathic
Mhm.
medicine, right? But there's the signal in the brain coming, that's askew. And in the high performer situation, that looks like ADD, ADHD, all the things that are their strong suits that make them really good. The ability to see this big picture, the ability to multitask, literally have multiple thoughts at one time, to think really
Yep.
quickly. It's like that processing speed is excellent and translates into this incredible success. But then later in life, because of that, and I really look at those things, even seizure disorders, as an autoimmune condition of the brain tissue, right?
Mhm.
And so there's this almost chronic pattern of really an upregulation, an autoimmune situation going on, which then over time, starts to you add in time to that and aging, and you're looking at neurocognitive issues, neurocognitive decline issues. And it was something that was almost like played out for them such a strong way for them that it's like, oh, well, I've lived off coffee my entire life and I'm just, I'm successful. I have all this money and all these things I could do. But I haven't been taking care of my brain ultimately. And there's that other side of the coin that oftentimes is at play with high performers and unknowingly so.
Mhm.
It sounds like you really kind of described what you mean by resiliency versus healthy or just being symptom free with that kind of description. But is there anything else you want to like add to like your definition of resiliency and what it actually means on a biological and energetic
You know
perspective?
how us women are always just pushing through it, and then when we go to find help, we're often not taken seriously or told, oh, that's just part of being a woman.
Yeah, we've lived through it. Prioritizing everybody else and then our own health falls to the wayside.
That's why we started Blossoming Longevity by women for women.
We created programs that meet women where they are, addressing the root causes and all of the struggles that come with every stage of life. Like our Vitality program, it reconnects you with your youth and your life so that you can thrive through the years.
And with Clarity, we go beyond the skin to restore your health, clear your complexion so you can feel radiant from the inside out.
With our Silhouette program, we help you reclaim your strength, optimize your metabolism and your body composition so that you can feel great in your body again.
And with Harmony, we help you rebalance your hormones to heal from within so you can feel vibrant and ready to take on the world. That is why it's time to stop settling and start flourishing.
Visit blossominglongevity.com today.
It's really the key to unlocking that resiliency to me is getting to the root cause and really identifying what's at play that's causing dysfunction in the organ tissue, gland, brain, nervous system, right? And going after that. And when we do that, what we do is we then accomplish a healing response in the body. And then that allows us to open the door to the next level of healing that needs to happen. And through a phased approach with our process, we go into that in that order, and it has to be in a specific order. And I like to refer to our process, the resiliency method, as more of an algorithm. People
Okay.
oftentimes are oriented to, well, I've got adrenal fatigue. So what's the protocol for that?
Mhm.
And that's not really the way we work. That's a good entry for many and can be, give them some result for a period of time. But in the longer run, we're really trying to understand what's bugging out the adrenals on the regular. And, to give you an example of that, we can say, well, certainly the external stress, but I encourage you to look at it a little bit more broadly because I also think that as humans, we actually are highly adaptable. We have an incredible innate intelligence at play all the time that is designed to heal. And in the example of adrenal fatigue, yes, their external stress can aggravate any scene, any condition,
Yeah.
but it's not really the root cause. And I've even taken a lot of my patients beyond, and we do get a lot of people that have worked on their health for a long period of time. And in the case of, I'll use the adrenal since we started there. A lot of times people are having chronic adrenal issues because the basal ganglia of the brain is hyperregulated. And then they're in a constant state of secreting excess hormones or cortisol in their system, and that burns them up. And they also have a nervous system that's hyperregulated from damage of toxins in their brain.
Mhm.
And then that kind of contributes to this constant upregulation and this constant secretion of cortisol. And meanwhile, we're just saying you're not meditating enough. Well, when they go to sit down to meditate, they're in such sympathetic overdrive, they can't sit still, you know?
Yeah.
Mhm.
And then
Yeah, I can't do it.
they're beating themselves up because I can't sit still. I can't, relax and I don't do enough. And we tend to focus that on ourselves and say, in the wrong, yet there's some things that we're not necessarily accounting for that are playing against our ability
Right.
to integrate some of those behaviors as well.
Yeah. Now, I know in your method, you do highly emphasize that healing is about the right sequence, kind of just like what we
Yes.
sort of kind of led into a little bit, but it's the right sequence at the right time in the right dose. Can you kind of explain what that means in your practice?
Yes. And so that kind of goes back to three phases. And in our approach, phase one is probably similar to what a lot of clinicians are doing out there. We look at things like stealth pathogens. We will run tests and look at the microbiome, the gut. We'll look for toxins, chemical, heavy metals, things like that. Those are fairly common, at least, more common, I should say, than they have been, a decade ago, which is
Yeah.
great because really that's where we need to be going after, or some of those really starting there with most of the population, if you ask me. So
Hmm.
we now the good news is we have some really great tools and we have some great clinicians that are going after those things, and you guys are I think are in that crew from what I've heard too.
Yes, we do a lot of those functional medicine labs. Yes.
Yeah. Yeah, and not just the labs, but, like, what you're finding in the labs, right? And then you go after
Right.
that root cause, which is excellent, and we don't and I always say to people too, like, another distinction would be instead of just seeing maybe that there's a B vitamin deficiency might show up on a lab test, for example. In our process, we're gonna go, "Okay, well, great. Maybe we give you a B vitamin deficient or a B vitamin supplement for a little while to bring your micronutrient status back up, right? And then we could run a test and say, hey, oh, look, the B vitamin status came up. That's great. Yay. However, in our process, we're actually asking the question beyond that. We want to know what's going on either with the nervous system, where you might be utilizing and going through your B vitamins quickly. Maybe there's a correlation to stomach acid intrinsic factor. Maybe there's something going on with the spleen that's causing some kind of anemia for you. We're kind of asking those questions and using that as a clue to see, well, what needs to happen with that organ, tissue, or gland on a supplement level so that we create and facilitate a healing cycle. And a
Hmm.
healing cycle has a start point, midpoint, and an end point. Once that's complete, then we have some improvement to that organ, tissue, or gland. So ultimately, you keep doing that over and over again, those sequence of healing cycles. And then that kind of earns you the right then to go into the next level of care. And that brings us back to the phases. So our phase one is similar to a lot of other practitioners. Phases two and three are quite different. Are going in completing phase one really earns us, I call it earns us the right to then have access to a deeper level of work inside the body. So for
I
example,
like.
yeah,
Mhm.
in our phase two, it's kind of interesting. I didn't set out to do this, but this actually just accidentally happened. But
I love it.
once once
Best
we
accidents.
yeah, yeah, best actors. Once we got completed on phase 1 with our clients, and then that's where I was stuck for a long time, and that's where I had a lot of patients were sort of recycling phase 1. And they got great results, but then I found I'm like, we're just still kind of managing some things. Things aren't fully resolving. I feel like tenacious enough and irritated enough with my own, lack of result that I want to keep pushing through. And actually, the way I discovered phase two was I was actually at a health conference and a pretty prevalent one that probably you guys have been to too. And I was walking around with a walking pneumonia, and I'm like, what is going on here? And I had just done some incredible healing work prior to that, and I was feeling like I was making really great progress and moving forward. And then I'm like, can someone try to adjust my back? And, they're like, you have walking pneumonia. I'm like, you're right. I do. I feel so sick.
This is
And
so
so
funny. You
that,
guys are so
I,
many of the same thing.
Yeah, we have
yes,
so much in common because I too have had walking pneumonia a couple of times where I was just keep on going and stuff, and I was like, "Hey, Serena, I'm just like it's hard to keep catch my breath. Can you listen to my lungs?" And I hadn't been
yeah,
sick for like 2 months, so I'd had it for quite a while. And she's
yeah,
like, "Go get an X-ray. I think you have pneumonia."
yeah, yeah. And you know what I discovered about that? It's kind of crazy. And this could probably take us into a whole nother topic. So I'll just put it out there. But that was a lot of my nervous system trying to detox. And it was going out through my upper respiratory system. So if you think
Hmm.
about the location of the brain, it usually, what I've discovered is the brain likes to take its garbage out through the sinus cavities and the upper respiratory system. It'll
Oh, I
take it
love
out
it.
through the posterior gallbladder and through the bowels, of course, in the usual drainage pathways. But that one caught me off guard. And ultimately, what I uncovered through that process was this mycoplasma that needed to be cleared from the body. And we had a specific way of doing it. And then lo and behold, based off of, again, sequentially, it's not just mycoplasma, it's doing phase one, clearing out the mycoplasma. Then all of a sudden, we got access to a really high quality bioavailable collagen. And the next thing we knew, the worst food sensitivities had reversed
Mm,
completely,
mm.
including my own with a horrible gluten sensitivity that was like anaphylactic.
Oh,
Wow.
geez.
And I'm not sitting here saying you should do this so that you can go out and eat, GMO wheat and gluten.
Have your donuts.
Yeah, although that is nice every once in a while. But that's not the goal. The goal is not to introduce those things back in.
Yes.
But what it said to me was, "Oh, there's another level of immune system function happening here and nervous system function happening here." And then that led me to start looking at allergies completely different. I was like, "Wait a minute. If we're reacting to our environment so sensitively all the time, or if we travel, we have to have everything so controlled, so tightly. We got to bring an extra suitcase with us with all our devices. We got to excuse ourselves from the table because the lighting is giving us a headache." I'm like, man, are we healthy if we're having to like overcome and accommodate ourselves so much in these scenarios? I'm like, we need a better adaptability index as coming along in the health, in restoring our health process, right?
Mhm,
And so that's what I really realized is by creating an environment and a terrain where we weren't hyperactive to our food is probably a good course to be on, since that's the number one key thing that we heal with,
mhm.
right? That's our fuel as
Yep.
humans. Yeah.
Should be. Should be
Yeah.
anyway.
But then that led into, okay, great, we've done that. Now we don't have these recurring parasite infections happening. We were able to move into deeper levels of detox with the body and do cellular level detox. And then once we got to the cellular level of detox, we actually could map out where people were aging into. So, for example, when a patient get to this part of the process, I could say to them, "Who in your family has X, Y, and Z?" Because through the analysis we were doing, we could see where they were aging into a pattern of illness, not just based on the symptoms that they came in for, which was crazy. Then I was like, "Oh, we're playing the longevity game now."
Yes.
Yeah. And that right order, right time, right amount piece is really what makes, I think, phase one for us even smoother for
Mhm.
people, especially when people are high performers. They don't have a lot of time to be like in herxing and healing crises and such. So it's really important to organize it so it's in a really customized way for them. But I've also seen too where just even protocols with some of those things is also great for some bodies. The more sensitive types usually respond really well to our process because of that.
Nice.
Okay,
Mhm.
so let me try to summarize the sequence for our listeners. So it sounds like you really start by like removing the barriers, like the
Yeah.
infections,
Mhm.
toxins, all of that stuff. Then it's more about like healing the terrain, like making sure our gut can absorb our nutrients and we can heal on a deeper level. And
Mhm.
then lastly, it's about looking at like, patterns that are going to lead to more chronic disease or like the aging patterns that people. Is that a
Yeah,
good
that's
summary?
well, and we're kind of midway there. We're in phase 2, but phase 3 is really about repairing and restoring. So then that's what we can identify that. So the first 2 parts I described are phases 1 and 2, and yeah, that's really dumpster filling phases. And then phase 3 is like repairing and restoring. So then that's like, okay, great. Well, if we know that there have been toxins in these different areas and we've had stealth pathogens hanging out, well, obviously there's some organ tissue, cellular damage and such. So then really that's focused on primarily, I mean, you're rebuilding throughout, right? Because in order to heal, quite frankly, you need energy and you need energy at a mitochondrial level. So sometimes we're supplementing and boosting the body to do that so we can keep moving forward in the healing process. But by and large, phase 3 is really working on what we call, the senescence piece, really, and
Mhm.
building out, kind of forcing the body to let go of some of the damaged cells. And then that makes way for repairing and restoring and nourishing organs, tissues, and glands that have been depleted for a long time. And then we do that at each of those levels. And then in particular, also for the nervous system, the brain. And what we found from doing that was what probably the most interesting piece of this whole process really is that when we created an environment that was vibrating at a much better frequency and energy level,
Mhm.
then it was safe the body to do something that I don't know a lot of people are getting to, which was to let go of toxins that were stored very deeply in their body, in particular in the fat tissue, whether that meant body fat and or brain nervous system level. We also found that the body was encapsulating toxins deeply into the liver and even sometimes the spleen, but just really anywhere where there was accumulation of toxins and namely heavy metal. But I've seen some patients, like one example I'll give you is one woman I have grew up in the Ohio rubber belt of the
Mm.
country, and found vinyl chloride. I'm like, where were you exposed
Ooh.
to vinyl chloride as a kid?" She's like, "Well, I grew up in Ohio. We made tires out there." I'm like, "Oh, okay." Well, that was accumulated deeply in her, 72-year-old body. And because we had done the sequential healing we needed to do, well, now those encapsulated toxins, the toxins that have probably been in there the longest and for the longest, and then maybe that are even starting to harden and calcify, like in the brain and the arteries, were ready to start moving. And
Mhm.
that was only because we said, "Hey, body, we cleaned up everything else out here. Does it look okay now? Can you let go of that?" And gradiently and gradually it would. And we've used some inhalation of hydrogen as a means for helping to kind of dissolve and mobilize some of that phlegm, I call it, or accumulation. And that's been really instrumental in terms of doing the detox at a really deep level. And that's the stuff, guys, that I think is really contributing to that longevity piece and the way that we age, right? Because
Mhm.
we look around and so many of our patients are really like also a little bit beating themselves up on the blame game, "Oh, you have fatty liver because you had one too many cocktails throughout your lifetime," or what, you know what I mean? And
Yeah.
or you're not been good with the carbs. And actually, I think there's actually more to that story that we're unwinding. Not that those things aren't important, you know, to
Right.
be watching, monitoring, and do the best you can with diet and exercise. But we're seeing like if we actually can get the body to agree that it's okay to let a little bit of that toxin that you've been holding on to move out slowly but surely, we're really hopeful that that's gonna really translate into, seeing better aging process, not having the dementia, Alzheimer's stuff, not having the complex metabolic dysfunction from the liver that's holding encapsulations that spills
Mhm.
over. Obviously, I know this is your world, the hormone
Yes.
health, of our patients, and that's kinda where we're at these days, which
Mhm.
is I think a little bit, interesting place to be for sure. Yeah.
So I know your background is, in Chinese medicine and energetics. So how do you merge these ancient medicine principles with like modern lab testing and nutritional science? And what are kind of some of the methods that you use throughout your different sequences?
Yeah. It's a great question. So everything that we do really does come from, and really even the resiliency method came from my background in understanding how the ancient wisdom of Chinese medicine worked. And what was so brilliant that, a lot of times these kinds of modalities get like a bad rap because the way we explain them is really kind of more esoteric and like, oh, you have to really think about the body now in this energetic way with meridians and channels, and it's like this whole 'nother theory that goes splits on top of our biomedical understanding of the body, and
Mhm.
that's a really just a poor description, I think. The Chinese actually were what's really so is the Chinese were really meticulous about doing human dissection and
Mhm.
studying the body and understanding how everything was correlated to everything else. So really what that boils down to in the study of Chinese medicine is how does everything like interact and correlate? How is the body a whole rather than a sum of parts? And that's what really informs us and makes us go, oh, what do we know about, the liver and how does the liver correlate to the eyes? And why do we see that when somebody's liver is super congested, they have itchy eyes or they have a higher histamine response and so all of those things really as a Chinese medicine practitioner, or I should say, trained and extensively in that, but then also in biomedicine, you can really start to put together the patterns of unwellness and start to see them. So everything that I discover clinically, I'm always like, what does the science say about this? And I can give you an example of one recently I encountered that kind of threw me was encapsulation of toxins in the mid thoracic spine. And
Oh.
Yeah, and I was like, "Why am I seeing accumulation of toxins in the thoracic spine?" Well, I know the thoracic spine holds all the nerves and signaling centers from the brain and the nervous system to the heart and such, and then I'm noticing that a lot of females have it, and it's, like, more right-sided, and I'm going, "What? What is where?" And then a lot of them have, the tendency to have osteoporosis and these Dowager's humps post-menopause, and I started looking, I'm like, "What in thoracic spine encapsulation and the cardiovascular disease and osteoporosis?" And there's actually studies out there. Like going, "What?"
Nice.
Yeah, and so it's like and that's what I do, that's how I'm informed. I start with the theory, I look at the concept as it was explained to me in Chinese medicine, and then I marry that to the biomedical understanding of what's happening in the body. And we talk in my practice a lot about phlegm and we talk about, blood stasis. And those are patterns recognized in Chinese medicine. What does that mean in biomedical terms? Phlegm is mucus. And that's a
Mhm.
immune response, and that's by design. So that it goes out and sponge like a sponge on your countertop, clean up all your crumbs, clean up your body. Over time, the need for creating phlegm all the time is usually as a result of some kind of autoimmune situation going on. And then over time, that need for continued repair in the form of phlegm, which also could put cholesterol production
Mhm.
into
Mhm.
that
Yeah.
as well, can accumulate and you start seeing calcifications, right? It's just like
Mhm.
aging of some of these chronic scenarios where the alarm bells are going off. And then you stop that progression, you get to the root cause, and then you're allowed to actually start going after removing that stuff and healing the tissue that's been damaged from it. And that's the answer, to
Nice.
reversing the chronic condition and to the longevity game, you know.
So, with that in mind, then what are some of the biggest mistakes you see patients make when they've tried everything, but they still don't feel better?
I think it's just that. It's like just organizing it well enough and putting things in the right order at the right time. The body's capability to heal is there. And I think that's really important to remind people of because that's not the way we were kind of, that's not what our culture and what our surroundings say to us.
Mhm.
In the world of health, we're kind of left to be victimized and powerless. And, like we have to outsource it to somebody. And I
Mhm.
think the first premise to start with is no, this body is way smarter than any laboratory scientist, any clinician, myself. I tell my patients that all the time. I'm like, your body's way smarter than me, even. I'm just here to help, like, put it in the right order. I'm just the organizer. I'm the composer right now. I'm gonna take over composing for a little bit, and then we're just gonna, like, let the orchestra play because your body is designed to heal. You can heal, and that's important to remind people of, you know?
Yeah, I
But
like
yeah.
I like how you say that, the composer. We're
Yeah.
Yeah.
composers. That's
Yeah.
much more fun.
It's an just simply organizing it and really identifying what's interfering. It's just that what's running interference here and not allowing the body to do that properly. And if we go after that and give it enough time, that's the other thing too. We have to get patients off of thinking that their health issues should be,
Snap of a
fixed in
finger.
3 months.
All done. We're good.
Yeah,
Yeah,
yeah. When am I going to be done
we see
healing?
that a lot.
Never. When you're dead, right?
So, talking about like patients and like how they can know their bodies better, how can someone know if their body is truly resilient? And are there tangible markers or indicators you look for?
Yeah. So, well, we're looking at for a lot of women, and looking at thyroids. Now, we get a lot of women off their thyroid medications, and the how fast that happen is always the question. So, I'll use lab testing to kind of help me understand, and that might be at a genetic level, it also might be at just like a biomarker level, and then just to see how they're responding to therapy as well. What I've seen in the example of the thyroid, some thyroids are super easy. Some are a little bit more complex. If they're more complex, it's usually because there is some kind of neurological component to their situation,
Mhm.
and it's sort of part in part. It's isolating, to the degree to which the damage is there, and we just measure and look at those throughout the process. So at the end of each stage of the process, we'll run blood work. Oftentimes, we'll do urinary testing for hormones. And
Mhm.
then when we get to that point of like, okay, all through all three phases, then I want to start looking, and we've dealt with those deeper levels of toxins that I mentioned that often are encapsulated.
Mhm.
I know there's going to continue to be that some cell oxidation response going on until we get to that level. So I usually like to
Right.
look at oxidative stress after we've kind of gotten to that level of detox, whereas a lot of doctors will do that in the very beginning. I'm kind of just making the assumption that it's pretty damaged, and,
Yeah.
people
You
don't
can
like
kind
to
of tell. Yeah.
yeah, people don't like to see that data either about themselves. It kind of freaks them out. So I like to use tests, in the sense of checking our work, I call it, dotting our I's, crossing our T's. We'll use
Mhm.
thermography in that way too for breast tissue. We have something called a heart sound recorder in our office that measures rhythm rate and tone of the heart so we can kind of stay ahead of if there's any have another angle on the tone of the heart, which is huge for aging. And then, yeah, oxidative stress markers, I would say, and then just checking hormones regularly. Usually, after a period of time, we can get off the regular thyroid testing because we'll see a couple results where those are still looking solid. The medication's not present. We can leave that in the dust. But I'll always continue to monitor hormones ultimately. And then we also access a neurological test. We like the one from Vibrant Labs called the Neural Zoomer because that gives
Oh,
us
yeah.
information. Oh, you
Mhm.
know that one, yeah.
Mhm.
That gives you that genetic piece, but also then that piece of, like, how are you showing up in terms of those biomarkers, and are you showing some kind of autoimmunity going on in the brain? So we love that one too.
Oh, that's nice.
Mhm.
Leading kind of into that, or kind of going back to that, if every practitioner was to adopt a resiliency based approach,
Mhm.
how do you think healthcare outcomes and like the definition of even just healing would really change?
Oh, I think it'd be profound.
Yeah. Yeah.
We would turn the ship around that has been, the course of that we've been on for the last century with the introduction of some of these toxins, and not only toxins, like in your daily living environment, but the fact that we have been breeding with these toxins. So the exposure rate has gone up, one, but then the breeding and the time of us breeding with these toxins, and these things, these parasites have, just contributed significantly to, I think, where we're at, which is, as you guys know, the more industrialized area of the world
Yeah.
and with some of the worst health outcomes, in modern society, which is befuddling. I think that would also put people into that position. This is what I'm really also interested in is giving people their power back,
Yeah.
you know, being
That's huge.
less
It's
victimized.
huge. People feel so much better with their power back and making sure
Mhm.
that they feel like they have the power to heal themselves.
Absolutely.
It's hard to explain to
Absolutely.
some patients. I don't know about you, but patients don't understand that a lot of times,
Mhm.
and it's really hard to get through to them until it finally happens and they're like, "I can be in control of my own health."
Mhm.
And it's a
Yeah.
really nice, like, aha moment. I love to see that.
Absolutely. You see the light bulb go off. You literally see the light bulb go off, in their face. But yeah, it's just another way of being. And then if we get their health under control, what is that person's ability to do in their lifetime, right? Like
Mhm.
this is foundational. And the people that are working with us see that value. They know, and I think, and my hope is that more and more people are seeing that that's a foundational pillar to anybody's life. So if you're playing the game of like, well, I'm just going to wait and see when the shoe falls, and before I start
It's
getting
already
serious.
falling, you just don't know
Yeah,
yet.
you just don't know, especially the high performers. They don't know,
Uh-huh.
because they actually are doing pretty functionally well and they're having success, right?
Mhm.
But then it catches up to them, and I'm going, "Gosh, you just built this empire, and now you wanna retire, and what's that gonna look like?" So I always tell people, I'm like, "It's a game. What's your strategy, with your health? But you cannot expect to enter the game in your 70s
Mhm.
and have great outcomes. You gotta be working at that now." And I think the good news is, I don't know if you guys are seeing this too, but like, the younger generations, I feel like are getting that at a different level than some of our older
Yeah,
generations have historically, which
Definitely.
I think
I
is
I feel like that's been it's all over social media and stuff
yeah,
now. The younger generations
yeah,
are, like, really wanting to at least address their health earlier on. I think we
yeah,
still have a lot of guiding them to do, but I think they're
yes,
interested in it a lot sooner.
yeah.
yeah, which is promising for sure. Yep.
Well, just to kinda wrap up, is there anything else that you would like to add about your method, or how people can reach you if they'd like to work with you?
Yeah, so we're at www.paramountwell.com. We are based out of the Denver area, Denver, Colorado area, but we also see patients, or we do telehealth with patients all over the country. And we work well with other providers as well. So it's a therapy and approach that really could be a foundation for how you're navigating and playing that game as you age. So that's how you can reach us. And yeah, thank you so much for this opportunity to share what we do.
Thank you so much for being on our show. We really loved it.
Awesome. Thanks, guys.
It's been a great conversation. Well, that has been another episode of Hormone Heroines. If this episode resonated with you, please share it, and we will see you next week. Bye.
Thanks for watching Hormone Heroines.
If this episode spoke to you, follow the show and share it with someone who also needs to hear it.
And write a review. That helps more people find their way back to balance.
See you next week.